There's no diagnostic test for ADHD, like a blood test or a psychological test. It's a clinical diagnostic. During the interview with the patient and their relatives, if needed, the clinician verifies the presence of diagnostical criteria and measures associated handicaps to orient the choice of treatment.
To perform a diagnosis of attention deficit disorder, we refer to the criteria found in the American Psychiatric Association textbook called DSM-4. They're exactly the same for a child, a teenager, or an adult. Someone who has difficulty to concentrate doesn't necessarily have attention deficit disorder. These difficulties can be induced by other problems like tiredness, insomnia, an unbalanced diet, or anxiety and worries that make it difficult to concentrate on the task. Depression often causes attention problems. Our work as clinicians is to clarify what is underlying the symptoms and identify if attention difficulties are related to ADHD or if they're caused by another problem. Attention deficit disorder englobes two major groups of symptoms: inattention and hyperactivity, impulsivity. To make a diagnosis, there are essential criteria to meet. The first is that symptoms are present since childhood. The second is that symptoms are present in many aspects of life, whether it's at home or at school, in social or professional life. The third criterion is essential. Symptoms have to be intense enough to become a handicap, a problem in everyday life. The last criterion is that symptoms can't be explained by any other pathology, like anxiety, for example.
Depending on the predominance of the types of symptoms, we'll talk about combined ADHD or inattention or predominant hyperactivity. Most people have inattention and hyperactivity symptoms. About 30% of them show only inattention symptoms. A diagnosis is then more difficult to make.
An attention deficit disorder's diagnostic is made when there are at least 6 criteria out of 9 for inattention, and/or 6 criteria out of 9 for hyperactivity, impulsivity. The first inattention criterion is the difficulty to focus on details. The person makes mistakes due to inattention. The second is the difficulty to stay concentrated for a long time because of distractions such as their own ideas or environmental stimulus, and loss of interest for the current task. The third criterion has been developed for children. It's a difficulty to look like they're listening. The child looks like he is elsewhere in his thoughts, and other people notice it. For adults, this criterion is much less obvious because grown-ups have learned to act as if they are listening. The fourth criterion is a difficulty to conform to directions to achieve a task. The person suffering from attention deficit disorder has difficulty to begin a task, to stay focused on it. They will scatter their efforts. Therefore, they'll have difficulty to complete the task. It's not that they don't want to, it's that they cannot. A person with attention deficit disorder has difficulty to get organized. They have difficulty to plan in their head as well as in their tasks. For children, an adult can help them to get organized, but for adults, this symptom becomes more of a handicap. A person with attention deficit disorder will wait until the last minute to do their task. It's often a trademark of people with attention deficit disorder. A person suffering from attention deficit disorder will be easily distracted by stimulus around them and their own ideas. They will forget things, and if they forget things, they'll lose their objects. For example, a child will lose his mittens and his pencils. The adult will forget where he put his glasses, will search for his keys, etc. Inattention symptoms can have a negative impact on education. Adults will have developed tricks, like taking notes and putting things in certain places. He'll delegate certain tasks, such as accounting, for example. He'll often stay handicapped in his daily life, at work or at home. When it comes to hyperactivity, it's the same as for inattention. There has to be at least 6 symptoms to make a positive diagnosis. Hyperactivity in a child is obvious. You don't have to be a doctor to see it. It's often very intense and disabling. The child has difficulty to stop moving. It'll be disturbing in class. In games, he'll interrupt. He'll push others. Symptoms are less intense for adults. Fidgeting changes into restlessness or discomfort, tension. The person will say that they still feel handicapped on a social plan because they interrupt. They have difficulty to make well-thought-out decisions. They'll be impulsive. In traffic, for example, they'll have a tendency to speed up and a difficulty to wait at red lights or at intersections. In this way, the person will still feel difficulties as an adult.
When I was younger, around 35 or 40 years old, I already was hyperactive and excessive. I was traveling a lot. It was fun for me to go to Mall Bay, to the coast. Most of the time, when I took a turn, my tires would screech. That means I was driving fast most of the time. Why? Well, I don't know. But it was a taste, a need. Simply a feeling. We go after feelings. When we're exaggerating, we get a satisfaction. I did it, you know. Why? It doesn't do anything. I didn't kill myself.
I got out of the lane and I just went on the 21st speed, and when I jumped, a car passed by and I hit its back and broke my leg. I broke my tibia.
Staying calm and concentrating for a long time is hard in ADHD. However, playing video games is easier. The task is more stimulating and is over a short period of time. Most adults who consult for ADHD have a relative, often a child, also suffering from it, for whom ADHD recognition and treatment were beneficial. Some are consulting for an associated problem, such as insomnia, anxiety, or depression.
I consulted because I always knew I had a problem, but I didn't know what it was. I couldn't put a name on it. I started to read up because Gabriel has this disorder. My husband and I were reading a lot on the subject. When I looked at the symptoms of attention deficit disorder, I said to myself, "Boy, I was like that when I was young. I was like that, and I still am." I went to see a doctor because I thought, well, now I've got to do something about it.
If someone thinks that they or somebody in their family has attention deficit disorder and wants to proceed with further solutions, the first step is to really get informed, to read on the subject. Then if you say, "Yes, I think that's it, and I want to get treatment," the next step is to consult a doctor. The doctor will do the evaluation, and if it appears to be a complex issue, he'll refer to a specialist.
What's important to understand is that there's no neurological test that proves for sure that a patient has attention deficit disorder. However, a neuropsychological evaluation can be very useful for a case of comorbidity in a more complex case where a patient doesn't quite meet all attention deficit disorder criteria. It can determine if the patient's complaints are related to attention deficit disorder or, for example, with an anxiety problem. The other important thing is that the neuropsychological evaluation process is not only limited to neuropsychological testing per se, even if it's the major thing. We also complete a clinical interview before starting to evaluate the patient with our test. We can use specific self-questionnaires that will help identify the patient's cognitive complaints. For the evaluation, we integrate this information to the patient's behavioral observations. We'll then have a more reliable diagnostic impression. Self-questionnaires and scales for attention deficit hyperactivity disorder are not exclusively specific to this diagnosis. Therefore, someone with symptoms similar to ADHD but secondary to another condition like depression or a head injury could score positive on some items of those scales. We have to look behind scores and ask ourselves why the symptoms are present.